Good afternoon, everybody. My name is Dr. Chris Bird. I'm here to give you the weekly pandemic report on behalf of the Coastal Bend COVID-19 Task Force. We have two objectives on the task force. The first is to address your concerns and questions about COVID-19, and the second is to help to enable evidence-based decision-making on behalf of our local leaders. Presently, nuecasknows.com has a risk dashboard which indicates we're at a high risk period, so it's important for people to stay vigilant in trying to stop the transmission of COVID-19. This is a code orange, which is one step below the top level, which is a code red. Right now, you're encouraged to get vaccinated. Don't wait. If you're eligible, you should definitely get vaccinated. The quicker you get vaccinated, the quicker the pandemic is going to be over. You're encouraged to avoid crowds. You're encouraged to wear face coverings and social distance, as well as isolate when you're exposed to COVID or symptomatic, as long as you haven't been vaccinated. There's partial to all remote schooling, and Texas businesses are now open at 100%. In terms of the number of cumulative cases that we've seen across the Coastal Bend, we're at 41,463. These are confirmed cases either with the gold standard PCR test or with one of the other tests combined with a physician's diagnosis of COVID. Of those, there have been 39,582 recoveries, and there are presently 685 active cases, which is down 23% from last week's report. So we continue to move in a good direction here. The active cases are declining, and hopefully COVID will continue to subside here. And it's really up to us. If we continue to social distance, if we continue to wear our masks, we'll be able to keep this trend going. So something that we can do with our modeling is show what would happen if. In this case, we've been showing this for a couple weeks, but we want to continue to show this scenario, which is what happens if we all unmask. And the importance of this scenario is that when we don't project a peak, if we all unmask and we all try to go back to normal, then it indicates that the pandemic is nearing an end. So first, we're assuming that if you're recovered, you're immune. Second, we're assuming that if you're vaccinated, you're immune. Now, we know that that isn't the case, but we're creating an overly optimistic model to let you know that we're not trying to scare you or make a very contrived scenario that's not possible. We're being very lenient with the parameters. The transmission rate is assumed to not be affected by new variants in the model. We know that it is, but let's see what it looks like if we don't take that into account. And we're assuming that there's 30,000 new vaccinations per week in the Coastal Bend, or at least up to that amount. That's the peak that can be achieved. It's a little bit lower at first. Now, right now, we're not able to vaccinate at that level because we don't have the supply. But the amount of vaccinations per week is increasing. So again, these are all overly optimistic assumptions. And the one thing that we want to bake into this model is we just go back to normal and we let vaccinations take care of things. Okay, in blue is our actual projection, and in orange is the what if projection. What if we try to go back to normal and let vaccinations take over? So first of all, the transmission rate right now is projected to be 0.91. That's represented here on this blue line. Now, if we were to try to all go back to normal now or in the past couple days, we would expect to see the transmission rate increase to 1.8 or even higher, given how optimistic we set the parameters of the model to be before declining again. Now, the reason why it shoots up and then it comes back down is this coming back down is people becoming immune to COVID by becoming infected. What we would rather happen is people become immune to COVID by getting vaccinated. But anyway, so there's both of those things happening here, and eventually we hit a point where we get below a transmission rate of 1 again. Okay, so what does this look like in terms of new cases? So the black points here, these are the number of new cases per day in the Coastal Bend. Each one of these black points is an actual data point. The orange is the model fit to the data. And the blue is our projection based upon what we saw, and the orange here is what if we let the only mitigation be vaccinations. So you can see that another peak would be projected right now if we tried to stop doing anything to control COVID except for vaccinations. If we continue on the trend that we're on now, which is wearing our masks, social distancing, not going back to normal, the number of COVID cases stays low and we don't have a peak. So right now there's a decline in COVID and it's projected to continue to decline if we keep up our vigilance. Okay, if we break down the number of new cases by county in the Coastal Bend, you can see that Nueces is having the highest number of confirmed new cases per day, but that has been declining, and it's been lower in other parts of the Coastal Bend, with Jim Wells, San Patricio, Clayburgh, Aransas, and B kind of leading the way for the rest of the Coastal Bend. If we continue to stay vigilant, we will see these numbers to continue to decline. When looking at hospitalizations, and here we have the projection again, but the black data points, these are the actual observed number of hospitalizations due to COVID per day, or number of people in the hospital with COVID per day. And what you can see is that the model is under-predicting the number of hospitalizations that we actually see. There's two reasons why this could be the case versus over here. One is that there's different decisions being made about who's accepted into the hospital that has COVID. It's possible that more people with less severe symptoms are being admitted to the hospital because there's more room. Another possibility is that the proliferation of new variants is increasing the rate of hospitalization per number of people that are infected. We're not sure which of these scenarios or which of these options is the true explanation. It's probably a combination of both of those. Nonetheless, we're projecting a continued decline, but if we try to go back to normal, we would most likely see another spike in the number of hospitalizations due to COVID. So again, we want to stay vigilant. Looking at the ICU, we're continuing the fairly long-standing decline over the last month and a half of people in the ICU with COVID. Right now, 25 people were in the ICU with COVID on March 17th. This is in the whole Coastal Bend. There were 140 people in the ICU without COVID for a total of 165. The blue dashed line here represents the average number of people in the ICU in the Coastal Bend before we had our big spike last summer in 2020. And so that's serving as a benchmark. What you're basically seeing is that we're approximately able to serve the same number of non-COVID patients now as we were before the spike before. So there's been an increase in staffing to be able to accommodate the increased pressure from COVID. When we look at this graph across the whole state, and this graph here is the last graph we were looking at in the last slide, that graph is right here. You can see that there's a decline in the number of COVID patients in ICUs across the whole state. And on this graph, it looks like there's a lot of blue skies here. This graph indicates the amount of pressure on the ICU due to COVID, showing with more red being more pressure, less red and more blue means more normal conditions in the ICU. So we haven't seen this figure be so blue since I started showing it. And so that's good. Hopefully we continue to progress towards even bluer panels in this graph next week. Moving on to fatalities, they're declining. Now fatalities trail hospitalizations, which trail cases. So we're positive that fatalities are going to continue to decline because we're seeing the cases are still continuing to decline right now. The projection shows the fatalities continuing to decline out into the future as long as we keep up our social distancing and mask wearing and stopping the transmission of COVID with means other than vaccination. If we rely only on vaccinations right now, it's not enough. There's not enough vaccinations yet. We need more of the population to be vaccinated to stop another spike in fatalities from us trying to go back to normal. So again, there's very good reasons why you should continue to wear your masks, even though we have a projected decline based on the way on things are going now. This projected decline is only projected if we continue on the same path that we've been on with the mask wearing. In total, there have been almost 1,200 fatalities due to COVID-19 in the Coastal Bend, with 737 in Nueces County. I want to remind everybody that these data are counted from death certificates by the state of Texas, and that they might trail the local data by a few days. And we need to allow up to 14 days for the death certificates to be properly processed and get a complete accounting. What my hope is that we're going to stay below 1,300 for the whole pandemic. And the only way that's going to be possible is if we continue our efforts to stop the transmission of COVID with mask wearing, social distancing, not having big parties. Basically, it's not time to go back to normal yet. Moving on to something brighter, which is how are we progressing in terms of the proportion of people that have been vaccinated. In Kennedy County, they're approaching 30% of the population having been fully vaccinated. In Nueces County, we're right around 13%, and the other counties are somewhere between those two values, with Live Oak and San Patricio heading up the lowest rate of vaccinations with about 9.5 and 10%. All right, and for the whole state of Texas, we are here in the Coastal Bend. We're at 13.5% of the population being fully vaccinated. And if you look across the rest of Texas, there's only one trauma service area with a higher rate of vaccination, and that's the Panhandle up where Amarillo is. So we're doing very well in terms of the amount of vaccine that we're getting and being efficient at getting those vaccines into people's arms. Now, we're at 13.5%. Where we want to get to is 70, 80% of the population fully vaccinated. If we can get to that point, the pandemic will almost certainly be over. And lastly, we're going to talk about these cell phone metrics. We brought them back last week after a long hiatus, but they've really started to do something recently, and that's why we're starting to bring them back. So if we look at distance traveled and non-essential visits, there's been a fairly steady increase for the last month in these metrics, going above normal. Now, normal here is defined as how many non-essential visits and how much distance traveled did people do in the Coastal Bend in February of 2020. And it's a long-winded way of saying basically this is the benchmark of what it was like in the Coastal Bend before the pandemic started. And we're exceeding that. Now, different parts of the year have more traffic. It's spring break right now, and we might expect an elevated amount of traffic around spring break compared to February 2020. But nonetheless, this is concerning because these sorts of metrics can be correlated with the transmission of COVID-19 and could indicate a future rise in our case count. The other thing that's increasing are encounters. So these are when two cell phones come near each other for a certain amount of time. It's recorded as an encounter. Now, this wouldn't be in your home. It's somewhere outside of your home. And if two cell phones are next to each other for, say, like 6 hours, that's not counted. That's assumed to be some other type of experience. These are, more brief periods of time, maybe 5 to 10 minutes to an hour, where phones are near each other and then not. So again, that's up. Now it's still well below normal, but we're seeing this trending increase that we really haven't seen back since Christmas, and even then that was a really steep increase for a holiday before going back to the same place we'd been at for many months until the last month. And the last month, we're really seeing this sort of directed movement upwards. So this is cabin fever, pandemic fatigue, whatever you want to call it. And we have to be a little bit concerned with this because it could be a harbinger of what's to come in the future. If we don't stay vigilant, if we let up our guard now, it is certainly still possible for another outbreak to occur. So in summary, the transmission rate is 0.91. That means that for every 100 people that contract COVID, they pass it on to an additional 91 people. If you follow that forward, that means that COVID is declining. The important threshold here is it being below 1. Hopefully it stays there. The new cases, hospitalizations, and fatalities, they're all declining. However, the cell phone metrics are rising, and this gives us a little bit of pause because we know through our model projections and scenario of seeing what would happen if we let up our guard and just let the vaccinations take over to control COVID, there could be another major outbreak. So we want to encourage everybody to stay vigilant, get vaccinated if you can. Wear your face coverings. Try to wear a KN95 face covering. That gives you the most protection of the available face coverings. If you can't do that, then double up. A cotton face covering combined with a surgical mask gives you the equivalent of an N92 protection, which is pretty darn good and a lot better than either one of those face coverings on their own. And combined with social distancing, that should keep you safe. And lastly, multi-household and large celebrations are discouraged right now. I know it's spring break, and I know that it's hard to refrain from those festivities, but we have just a little bit longer to go. The only large celebration that you're encouraged to attend is at the county fairgrounds, where you'd be getting vaccinated in Robstown. So that is our report for this week. I want to remind you that you can find us on Facebook, YouTube, Twitter, and Instagram. Our handle is at CBCovid. These reports are recorded and posted there. You can also provide feedback. We encourage that. Ask questions. We'll answer your questions on Fridays at 12 noon with myself, the Public Health Director, Tiffany Anderson, and Jason Lewis from the task force. And we can address whatever questions you have. If there's no question that's too hard, we'll address it. I also want to take the time to thank everybody on the task force. It's been a while since I've done that, but there's a lot of work that goes into this every week. There's students at TAMU-CC that are helping with wrangling the data and putting together the graphs for this each week. There are people that we meet with each week on the task force, and we discuss the latest happenings and the latest data, and they provide valuable feedback that goes into these presentations each week. That makes me remember that I want to encourage everybody that, if you don't want to keep wearing a mask for yourself or your family, think about our healthcare workers that have been overworked for over a year now. They've been going above and beyond the call of duty, and they really want a break. And so what we could do as a thank you to them is try to keep COVID down right now to allow them to take at least a little bit of a break. And hopefully, the type of break that, we don't go into an outbreak again in the future, and that they get a permanent break from COVID. So that's the report for this week, and if there are any important updates, we'll be sure to post them on the social media accounts, and we'll see you here next week. Thank you.